Blepharospasm. That simply means spastic condition of the blepharum. Blepharum is the name of eyelid. So, it is a spastic or contractive type of condition of the eyelids. That means the patient may not be able to control the movements of the eyelids. It will be in a condition of squeeze or contracted stage. That is a forcible contraction of the eyelid. We can say in that way also. It will be beyond their control. So, most often the eyelid will be closed because of the contraction of the muscles around the eye. Most often the very initial symptoms will be twitching of the eyelids or sometimes involuntary blinking, frequent blinking of the eyelids, and sometimes it may be left unnoticed in the very initial stage. Maybe because of some irritation or foreign body like that, simply rubbing or scratching the lid like that, it will go some time, and gradually what happens, this blinking becomes more in frequency, and it will be more forcible, the blinking, like that it increases, and later what happens, there will be forcible contraction, forcible closure of the lids. This brings out so many practical problems to the patient. Sometimes in the main problem is that the patient may not be able to express the emotions, just like crying or laughing or smiling, like that. It will social communication and other things will be a practical problem that may seem much worried. Even though the condition is not concerned with the vision, that means even in the most severe conditions, the vision as such may not be involved. But since he is not able to open his eyes, practically we can say he is blind. There are conditions where the patient has to remain his eye closed for hours together. So, in a way or other, patient suffers a lot. If the condition is progressive and getting it progress, then what happens, the spasm may spread to the muscles of neighboring parts of structures. That means to the jaws or to the cheek or to the eyebrows and even to the forehead. Like that, spasm may spread, it may stretch to that areas also. This makes the expressions more horrible, more problematic, and not able to do his day-to-day activities even. Such a condition is known as blepharospasm. Most often blepharospasm is an independent disease, and it has its own etiological factors and its own progressive nature like that. But there are some conditions which may be misled or which may be confused with this particular condition. For example, this dystonia of the muscles, that the inability of the muscle, keep up the muscle tone, that is known as dystonia. This is of the facial muscles or cheek muscles, that also may be sometimes confused with this blepharospasm. So, this Bell's palsy or facial paralysis and dystonia, all these conditions, or even general muscular problems like myasthenia, especially ocular myasthenia, these all are having somewhat similar symptoms. So, a differential diagnosis is very necessary for the treatment purpose. This is a forcible contractive or spastic condition of the eyelids, not the paralysis. Other conditions are most often paralysis of the muscles and not able to raise his lid or open the eye. But this is for contraction or forcible spastic condition of the eyelids. So, a differential diagnosis is necessary. so that a treatment, perfect treatment can be followed. Then we have to analyze all these conditions on the basis of Ayurvedic principles, Ayurvedic theory. That is nothing but theory of Vata, Pitta and Kapha. Any movement is the function of Vata. So we can simply say that this is a disorder of Vata concerned with the eyelids. And there are different fractions of Vata that functions all over the body. That is, most often it is either on the basis of the actions or the particular parts of the body. So there is one particular Vata that is known as Vyana Vayu, that is functioning all over the body, and it is moving throughout the whole structures of the body. And some movements of the limbs on the small structures are the function of this particular Vata. So this closing and opening of the eyelids also is the function of this Vata, Vyana Vayu. So if there is a disorder or vitiation to this particular Vata, it will affect the normal functioning of the movement of eyelids. So that is the actual situation. And we have to also consider that particular structure where this function is being disordered, that is the eyelid. In the eyelid, the basic dosha, we will say sthanic dosha, is Kapha. This is a materialized or strong structure. So that is having the predominance of Kapha. So we have to consider that a Kapha dominant structure is vitiated by Vata, so that its function is not happening well. This is the condition on the basis of Ayurvedic theory. So we have to control, or we have to bring the functions of this Vyana Vayu back to normal for the treatment of Blepharospasm. For that, there are different methods. First of all, we have to see whether the condition is stretching to other sides. That means to cheek or eyebrows and this nose side, or to even to shoulder. In severe cases, it may be stretching up to the shoulder level or to the chest level. That also may happen in severe conditions. So most often the treatment localized in the eye may not give the desired results, because I have already told the Vyana Vayu is running all over the body. It is not limited to a particular area. This Sthana, that means the seat of this Vyana Vayu is in the Hridaya. Vyano Hridisthita, that means the actual seat is there, and then it is running all over the body. That is the condition. So to maintain or to control the properties and quality of this Vyana Vayu, we have to consider the Vayu as a whole. So here we have to start the treatment from giving medicines orally in order to control the vitiated Vata. For that, the name of the treatment may be, we can say just like anilomana. Anilomana means to normalize the abnormal system, which is that factor is there, function is there, but it is not in order. So the rearrangement or make it in an order form, that should be the aim of the treatment. That type of medicines are to be taken orally. Then the second step is treatments to control that Vata on the head region, on the eye or the other parts of the head region. So that type of treatments should be done either through the nasal cavity or on the head. So this Nasya, that is the method in which medicine is applied through the nostrils. That also comes into the scene, because it will act on the muscles and nerves of the head region in general. So Nasya is a very important treatment procedure, Then treatments on the head region, just like Shirovasti or Shirodhara, like that, also should be necessary. That depends on the severity of the disease. I am talking about the serious condition, not blinking, excessive blinking or excessive twitching of the eyelids. That can be controlled by localized treatments in the very initial stage. Otherwise, this type of treatment should be necessary. Then very special treatment procedures locally on the ocular system also is highly important. That is this special type of eye massages and fomentations, that means making it hot. Then comes very specified treatment procedures such as netra tarpanam, in which the medicine is filled in the eye for the calculated time. It will strengthen the muscles and also the nerves concerned and make the eyelids work in the proper way. These are the different treatment modalities we have to adopt in the treatment of blepharospasm. Actually, stress and tension is a basic reason for the development of blepharospasm. And once it is happened, the problem is already developed, then it triggers any stress or anxiety or tension, whether it is work-related or professional or family or personal, whatever it may be, it will increase the condition because it is already spasm. We can just think, if there is a stress or tension, there will be an automatic spasm of our muscles, especially of the forehead, and we will be squeezing the eyes or thinking and sometimes biting the teeth, like that happens. So this is the condition, this is the pathology that is already developed. So if there is such a situation, automatically the symptoms will be triggering. So side by side, we have to do something to control this aspect also. We can adapt some, that type of treatment also is there, this Shirodhara and Talam, we will say, putting medicine on the head or head massages. This will control that also, and we can take, if necessary, that type of oral medicines also, not sedatives, that will not give that much result, but soothing the nerves or controlling the function, that will help. I have seen in many cases. That is one thing, or yoga or pranayama. These are also highly beneficial in this situation, which will give them mental relax and also physical well-being. Then another fact is that if the symptoms are severe and already affected the neighboring structures, such as cheek muscles, facial muscles, or this neck muscles, etc., then it is better to do some treatment procedures to strengthen that muscles also. For example, if there is if it is affected these facial muscles or cheek muscles, we can do Gandoosha. Gandoosha means it is a very special type of treatment procedure in which the medicine is kept inside in the mouth cavity, in the mouth, and to withhold it the maximum time, then spit out, like that. So that type of treatments are there, and different types of facial massages and neck movement practice, neck exercise, these are also found to be very effective. We have already seen that the muscles are under stress and it is not in the normal function. So a basic level strengthening or soothing of the muscles is the first step of the treatment, and that should be done under supervision and under the hands of an experienced hand only, with the complete total eye rest. First of all, eye should be in a rest mode. That means need not close. I mean, don't do too much strainful works with eye, mobiles or computer works or travel, etc. So that should be done in a hospital only, should be in an inpatient level treatment. It doesn't mean that all the treatment is finished within that short period, because this is for the basement work. After that, we have to do or to follow some treatment procedure, not treatment procedure, some medications. That should be done at home and without any serious restrictions or powerful or serious monitoring or supervision, etc. So this is the method how to handle a case of blepharospasm. Because most often what happens, only severe conditions only come to Ayurvedic treatment. If it is very initial stage, no need of hospitalization, no need of very basic level treatment procedures are not necessary. Simple fomentation or medicine application or oil application, head massage, this will be enough and more. Otherwise, we have to do these steps at first in the hospital, then follow the restrictions and medications along with their routine life. This will give a very good result. Anyway, we have to adapt 2 steps in the treatment. First is to maintain the mental status and the stress level under control. For that, various treatment modalities and also other methods like yoga, pranayama, physical movements, exercise, these are highly beneficial. And side by side, very special specific level treatment procedures are there to strengthen the muscles and to control the spastic nature of the eye muscles, especially around the eye, not inside the eye, around the eyeball. That muscles also should be considered. And if the situation is more severe and is spread to other structures also, the cheek muscles and other neighboring structures, we have to consider that structures also and also from the central level. Or if we are taking a very clear differential diagnosis, the treatment is very easy and will get the maximum level of benefit also. Result is very good in my experience.